No, no, it started.
Take the phone out of your face, you will get locked out.
Okay.
Then you'll have to call me only.
Yeah, I know. Can you close it? It started.
Are we
Hi.
back?
Okay. Is it okay?
Are we back?
Yeah, yeah.
So sorry. I don't know where the connection is wrong, but I've
I
been connected to my.
I don't know if it's a you thing or a me thing. Like I don't know what's happening.
Sorry.
Um.
Um, I just so I have put my. Okay, you can see me. You can hear me
Yeah,
well, right?
yeah, yeah, yeah,
Okay. So I have used the internet connection in the library, and it seems to be okay so far.
yeah, yeah.
I suddenly lost.
Um. Yeah. Okay. I think we'll have to
So
restart
sorry.
the live,
Yeah.
if that's okay.
No,
Um.
that's okay. Let's just do this. And
Yeah.
so should we
Um.
restart now?
Yeah. Once more people join, then we'll start it again. How much time do you have?
30 minutes, or
Okay.
should we should we keep you there were you want us to restart after a bit? I can see
Um.
some people.
Yeah, yeah. Okay. Yeah, we'll just start it now. Because I'll have to post this on the
Okay, so
account.
then we'll wait.
Yeah.
So we'll wait.
Um,
You tell me, then we'll
I'll,
restart it
okay. I think we'll wait for like just a couple more people and
fine.
then I'll
Okay,
begin with the
done.
introduction again.
To just come and check. I'm going to ask him
Yeah.
to come and check just in case we have an issue again. Okay.
Okay.
Unbelievable. But
This
what
never
to do?
happened. Yeah.
If it's never happened, then I'm really sorry because I don't know what it is.
No, I don't think, I don't know if it's your connection or mine. It could also be mine.
No,
But
but it's never happened with you. So, which means it's probably.
yeah,
I put the
what
best
can you
connection in
do?
the. I don't know. It seems to be okay so far. So, should
Yeah.
we?
Yeah. Okay, I'll begin. Okay. Um, just anytime you can stop me if the connection goes.
I think
And
so. Okay.
yeah, okay.
So, should we
Um,
start from the question that you were asking, or do you want to go all over again?
I'll begin with the introduction and then I'll ask the
So, for
question if that's
introductions, just say Priya Selvaraj, GG Hospital.
okay.
So far, it looks good. I don't know. It might.
Yeah. Okay. Hi everyone. This is like attempt, I think 3 or 4. But I'm here with Dr. Priya Salvaraj, who is the Assistant Director at GG Hospital. She is a fertility specialist, clinician, embryologist, and she has more than 17 years of experience.
And
Um,
that's it. So I'm here to
yeah.
answer all your questions on menstrual hygiene and menstrual health.
Yeah.
And thank you for having me here on this
No,
platform.
thank you for coming. We're so honored to have somebody that's so credible.
Thanks
Um,
so much.
yeah. So question one
Yeah.
is, when should we start visiting a gynecologist and how often should they go?
Yeah. So as I was telling earlier, when we got cut, we see a whole lot of patients starting from adolescent kids and reproductive age group women comprising of late teens and early 20s. And there is no rule that you have to visit a gynecologist per se, but worried parents bring their adolescents to us because, when the menstrual cycle starts, they tend to develop irregular menstrual cycles or excessive bleeding and cramps, and sometimes excessive blood loss, which makes them anemic. And concerned parents bring them to us to for us to check the child and also to give them a little bit more awareness of what happens when they first start their cycles. The other group who have crossed that phase will come to us with, usually they talk about irregular menstrual cycles like PCOS, and about acne, and about any, a wide range of vaginal discharge, which concerns them. And it's more than we as specialists and gynecologists or fertility specialists, uh, we tend to see them when they have specific complaints. But because we are on the fertility front, we tell young girls before they are about to get married to come and bust all their myths and concerns with us before going and getting married, so that there is no concern, they're bold to face the situation and they are able to take on anything. So I would always say, before you're planning anything in your life, say a marriage or childbirth, you come and visit us. So there is checkups are already being done in schools in a very nice manner, and children are being checked up. A lot of menstrual health as well as sexual health classes are also being taken, and children are already exposed to these at school. So as of the last decade, we have had very less issues regarding that. But as I always say, and I've told you before, that education starts at home, and we as mothers and should start that with the child. The dialogue begins at home. So if we prepare the child then knows, when to say there's a complaint or there's an issue or there's something to share with the parent. Then they take an informed decision and come to the gynecologist to solve their problems. So it's a very tricky thing. Like, you can't say, okay, everyone should come and visit me, but at least if they know when they should, like all the list of complaints that I said, or when they don't have a complaint but they are planning some moves in their lives, then let me also put in this. There are people who are sexually active before marriage, right? So even those group of girls, anything that they do, any decisions they make, it would be great if they came and discussed it with us, so that we can guide them safely. Then you can prevent infections, you can prevent STDs, you can prevent unwanted pregnancies and things, and we can guide them through their reproductive career as well. So I would say these are the reasons why you should visit us, to plan ahead. And children per se, dialogue begins at home. So the mothers should be well informed and take home the right information to teach their children. Tell me if this is happening with you, and then we will go and visit. Yeah.
So sorry. Someone was calling. Yeah, that was a very detailed answer. Thank you for that. So is there a specific age when an individual should stop visiting a gynecologist? And if there is, then when?
Like I said, usually late teens and early reproductive age group in their 20s, it would be wise to go for a medical health check. Not specifically to a gynecologist, but it would be good to assess their bodily functions. And basically, Indian women are anemic, and especially the girl child, there could be setbacks in their health and diet. And, because they have the menstrual cycles happening, there's a lot of emotional and physical turmoil happening through those cycles. So basically, if they, kind of lack the support, as in, lack an awareness of how they should look after themselves and what they really need to do to take care of themselves and live healthy, I guess then, that would be the right age group in the late teens and early reproductive age group. So that they, because people tend to, even these days, educated people tend to get married at the legal age. So it's not that they're waiting for a career. So these things happen. So I would say, I would encourage parents, at least if not for anything else, bring them over so we can talk to them, counsel them, and talk to them about their diet and physical well-being.
Okay, yeah. The next is, how can one maintain good menstrual hygiene? And could you elaborate on how reliable and necessary these genital washes are?
Okay, so I'm going to talk based on personal experience spanning some 4 decades, as well as what I'm doing with my kids. I have 3 teens at home, 2 of whom are girls. And so I have to say, because I belong now to the generation which has seen the old and the new, I'm right bang in the middle of it. So I have seen cloths, I have seen all of that being used, and then slow transition into the early carefree days when it was first introduced, the early ads. My first introduction to tampons from the US, from the company Tampax, hidden in my mother's cupboard. And then, because nobody wanted to raise questions of what is that, what is the thing in this container. So and right now, up to the use of menstrual cups, as well as reusable pads, and of course environmental friendly pads. So outside of all of this, personal hygiene, no one spoke to us completely about personal hygiene. It was just understood and taught to us very as a matter of fact and casual. Yes, you take a bath, then you pour soap, and use your soap all over, including your private areas, and then you just wash yourself, and that's about it. But whether it was healthy or not, what is the kind of soaps we are using, and what kind of very scented soaps or anything that we're using near the genital areas, how do we wash the genital areas, which is the right way to wash it, do we wash after every toilet activity and things. Everything was not broken down very well. Okay, this me coming from a medical background. Everyone was busy, everyone assumed things will go well, right? And so transition and fast forward to my state as a mother, I've learned a lot, seen a lot, and on my own personal experience and things, over 17 years of using certain products, I can assure you that the best way to maintain the hygiene per se is to use nice running water, and make sure you know how to separate your private parts, the labia, and go smoothly around all those areas. Always wash from front to back. Never bring back the hand from the anus to the vaginal area. And try to, I approve products. I approve feminine hygiene washes because I've personally used them for more than 17 years when they first came into the market. And I have not had a single urinary infection or a fungal infection over these last so many years. And this is including 3 childbirths. So if not for anything else, a very, very mild scented soap. Okay. Now, with regards to hair, and how do you maintain hair growth and things like that, because all this is a part of your hygiene, whether it's menstrual or before and after. These all go hand in hand. So every day, use a good body, whatever soap you want for the body. You use a feminine hygiene wash for the private parts, including the anal area. And then you don't do douching, and you don't interfere with your vaginal flora by inserting anything or washing it out, anything. It's only the external surfaces I'm talking about. And hair is your choice. Now, it's become a people's choice. You want to keep hair, you don't want to keep hair. If you keep hair, are you able to maintain your hygiene? Are you maintaining your cleanliness at regular intervals to make sure that you don't get infections? So I approve hair trimming, which I think is hygienic, especially for young girls who are stepping into this, who are observing hair growth in the beginning. So you don't have to jump to shaving, you just trim your hair. I advise mothers to teach their children how to trim, or they do it for their children, till children become independent enough to trim their hair. We have these razors, it's called Elegant, and these are used to shave private parts among our patients. And these are dry razors. These are also very good. I haven't seen ingrown hair or folliculitis or anything using these. These are also very convenient. I've used it on my kids. And now they become independent enough to shave their armpit hair and their pubic hair. And as far as depilatory creams, which I've also experienced in my life, earlier days, it suits some, it doesn't suit some people. There could be discoloration. There are chemicals used. You guys have read up all of this and you know it. So I would advise no. And I would advise waxing and lasers at an age group when you're able to understand it and you're able to tolerate all of these. When your flora has matured enough to tolerate all these insults, you see changes in all of this. So right from adolescent to late teens till you're possibly 18, 19, I would say keep it natural. keep it less complicated. You want to venture into complete hair removal, stick to shaving. You want to go a step beyond that, try waxes, but in a very hygienic manner. You should be very, very sure of what you're using and where you're going for that waxing. And lasers come much later, because over the years when you do this, the hair growth tends to kind of drop. And if you have other hormonal imbalances like PCOS and things, we will correct that on the side, which will help the hair growth to reduce in the long term. So that is our job to take care of. I think I've spoken about the hygiene part, but if there are any other extra queries that you need to know, so I say no deodorants, no scents, using the feminine hygiene wash based on personal experience and what I see in the people that I have recommended to. There is no damaging odor, or there's nothing. This is, you have to get used to the idea that we have a natural body odor, which is fine. Vaginal odor, musky, whatever it is, as long as you're hygienic. And when you use these washes, you will really get a neutral odor. There is really no odor. It's like that. Yeah.
Okay. Yeah.
And you want to keep your sexual life in a good way, you wash before and after. Simple. That's what you do. It's a respect for the partner. It's respect for the act. Yeah.
Yeah. Okay. Yeah, I think you answered that very well. So the other question is tampons versus pads, and also cups versus cloth pads.
Okay, so that's 4 things. So I recommend, so I will split all this into different age groups, and what I feel would be good for the adolescent and just, the early teens are people, like I've spoken about this to my own kids, and although everyone knows everything and they are well informed, usually they are not as mentally prepared to breach anything in that area, like the American or the other kids, where they are open about many things and they're able to understand and say, okay, fine, let me try it. So you can only try, you can only explain. But I would say, why disturb anything when things are going in a natural way? So I prefer that currently, because you have so much of environmental pollution and people are aware of carbon footprints, and including our kids, the present generation and the generation in the last 5 years, they've become very environmentally conscious. And based on that, our menstrual products are a huge range now. Like, there is a variety out there in the market. So I will say, for parents who are dealing with children who have just gotten their menstrual cycles, stick to biodegradable ones, stick to the natural ones, give the businesses to our women who are working hard behind it. So reusable cloth pads, I approve. I approve all your new biodegradable products, yes. What we were always left with is a usual whisper, carefree, stay free. If you want to dispose these, you need to unwrap and then take the cotton and then use it for disposing or flushing. And this has to be wrapped separately. Now, how many people will actually follow that? Hardly. So I would say early, when you're experiencing your first menstrual cycles, stick to these kind of natural pads. You don't have to immediately jump to using tampons. It takes a lot of awareness, and especially for young girls, 14, 15, 16, to get used to these things, right? And parents are also very skeptical, they're very skeptical. How can we insert it when it's related to virginity and things, which are all big myths. We all know that. So we are talking about a thin membrane, which may not even be there, which may have moved when you exercise or whatever it is, or any kind of activities. It is not a sign of virginity, and it has nothing to do with losing anything. Okay. So now, having put aside that, the question is compliance, both on the parents and children. And when it is not there, no need to force. And tampons, again, requires a lot of knowledge. Okay, they should not be forgetful. They should be maintaining a very good hygiene when they use tampons. And, they have to know not to panic. They have to know that things can get stuck, that part of the cotton can stick in. When you're using these natural products, even in tampons, it has happened before. We've seen cases. So compliance, awareness, understanding, and all this involves, and this is not the age group that usually is having all of these things. So I would push that to the late teens, early reproductive age group, and any woman who is given birth and whatever, married, whatever, they all are more compliant. It's better for them. And menstrual cups as well is my best deal. I've personally used it and I like it. The only thing is, there is a learning curve for everything, especially insertable devices like tampons and menstrual cups. There is a learning curve. So if you're able to get past that learning curve and know how to insert effectively, I would suggest menstrual cups ideally for women who are married or who are sexually active. Anywhere, anyone who's sexually active, it can be any age group. And people who are married or who've given birth, because the compliance rate is higher, and it's easier for them to manipulate in case they're not able to insert it well, or it's not fitting properly, or whatever it is. The trial and error is ideal for these people who are already aware. So it's a beautiful deal to have a menstrual cup. Not only is it cheap, and it's a one-time investment almost, and it's easy to maintain. You can carry it everywhere, and if you're an expert at it, nothing like it. I totally go with the menstrual cup for the groups that I mentioned who are compliant. Anyone who's physically active and who knows how to use a tampon, please use the biodegradable ones as well, but learn to change it. Do not use it overnight. For people who are regularly using tampons, I always say use it during the daytime, but overnight wear a pad. Just wear a pad. Yeah. Is that okay? Did I not cover something?
No, I think you answered it. But could you give us like the advantages and disadvantages of these products? Maybe because like some people are comfortable with some.
Yeah. So I would say, Aishwarya, that everything is a personal choice. See, whatever I have spoken, I've mixed a little bit of experience and what the patients come forward with, or what I see in my own home. Everything is about personal choice, what you're comfortable with, and if you're well aware of consequences, then I guess it's a very, very personal choice. Now, let me tell you even about tampons. You have these lovely plastic containers which will just push it in smoothly, and removing everything is heaven. But unfortunately, it's not good for the environment. So then you're forced to use the ones which are pure cotton, which again, the thread might come off, or, there's something, the applicator, the application itself is cardboard, right? So, the edges which are not smooth, or, it might not push out well. I'm talking very practically because I've seen it. And, so I guess it depends on your personal choice, and there's no one product. But if going forward, if I have to make a choice, I have moved completely from the synthetic, industry, because I've suffered, irritation and rashes and total non-compliance with those products. And now that we are becoming environmentally conscious, I would now actually put a full stop or a hold on that, and I would encourage at least the coming generations to stick to any of these modalities. You can use, everything is available. Even your Instagram sends you absolute ads, and I don't want to name the brands, although I support some. Everyone has biodegradable products, and they have different sizes pads. You don't have to just stick to tampons or be with the crowd. Oh, everyone's using it, but I'm not using it. Not at all. Do what is good for you, and that you want to progress in a right way at the right age, starting from a pad to a tampon to a menstrual cup, or you want to make the direct jump. It's all according to your convenience. So pros and cons, like I told you, it comes only by use. See, although the menstrual cup is one of the best things to have come out in the market, again, how you insert and how you have to get used to it. So there's a learning curve for everything. And now, as and when I'm exposed to more and more products which I want to try myself, I now realize what kind of an industry is brewing on the side, because you do not know what goes on in their manufacturing. And if you read any of these packages, there is nothing mentioned there as to what they are using, what are the chemicals, what is the plastic that's going in. You have the biodegradable plastic and the non-biodegradable. So we are not, so everyone's concentrating on, being no odor, extreme absorbable capacities and things that wherein they introduce some toxins during that process, right? So one part of it is affecting our health. The other part of it is affecting the environment. More so because even if we are completely aware of what we want to do with our bodies and how well we take care of it, how do we dispose the educated and uneducated come on the same platform in that way? We have girls flinging the pad like that because they don't want to enter the room in the hostel room where the dustbin is kept, because it's already got pads littered around, or there's a smell or whatever it is. You fling from here hoping to make it into the like hitting a golf ball in the golf course. So I've seen that happen. And then hygiene is not maintained in the college hostels or in school, school campuses, unfortunately, because children have to be taught all of that from home. And all this affects their own personal hygiene as well as the environmental, what they disperse even among sanitation workers or anything. So compliance, awareness, what suits your body, what does not suit your body, it comes at different age groups. And I have recommended as a gynecologist what I would feel for a young girl starting her menstrual cycles to how she should progress should be in a very, chronological way, I should say. Start with pads. Yeah, learn your menstrual hygiene and your menstrual health. Start with pads. Then you move on at an age group when you're able to absorb and know what a tampon is and everything. Move on to that. Then you move on to a menstrual cup, because physically you may or may not be compliant with insertable things. That is why. If you are, good for you.
Yeah, you have to be comfortable with the area first.
Okay. And you should know, basic thing is be aware that there's something inside and remember to take it out on time. Otherwise you end up with infections that you all are aware of now very well.
Yeah. So the next question is, what are the reasons for irregularities in the menstrual cycle? Like all of the reasons.
Oh, okay. The commonest reason that we see is polycystic ovarian syndrome. I don't like to call it a disease, but I'll just put it as a PCO or PCOS. It's a form of anovulatory disorder, which is a hormonal imbalance in the body. And what happens in these individuals, you have the lean variety and the obese people. So a lot of it is fat related as well. So your body weight, leading to disturbances in your hormonal milieu, which causes ovulation dysfunction, where you don't release your eggs in the monthly menstrual cycles. It causes an excess of male hormone in your body because the female hormones are imbalanced, and you have excessive hair growth, you have acne, and of course obesity and other skin issues, darkening of skin and pigmentation. So these are the extreme kind of phenomenon which we call a syndrome. But otherwise you have the other variety where they simply come to you. So the underlying thing should be irregular menstrual cycle, and then they have other features which, they have a little bit larger looking ovaries when we examine them on ultrasound, and they may have a bit of excessive hair growth and things, but they are lean and they really don't have to worry about the body weight part. So what we as gynecologists target is a whole lifestyle thing. On one side, we counsel them about a good diet and a good healthy exercise routine and fitness routine. And on the other side, we have to address the ongoing hormonal imbalance that is within the body. So there is this LH hormone, which is imbalanced with the FSH hormone, and that leads to an excess of testosterone levels in these girls. And the whole thing is again related to insulin secretion in the body, and everything relates to the body fat. So that is why when we say lose, at least for the obese individuals, lose at least 5 to 10% of your body weight to show some changes in these. Like if you are menstruating once in 3 months or 4 months, it might become once in 45 days to 50 days. So you will be helping yourself when you make a lifestyle change. So everything which started off with a genetic, genetic background along with lifestyle has now predominantly become lifestyle and then a genetic issue. So these are also related to thyroid. Irregular menstrual cycles are also related to thyroid. So we address everything at the same time. So the commonest is PCO. You could also have thyroid related issues, which may be causing menstrual irregularities. It may also be affecting the menstrual flow. And then extreme disorders are any kind of tumors that you have in your hypothalamo-pituitary ovarian axis, adrenal glands, You can also have precocious puberty. So this is going deep into the subject, but there are many reasons why you may end up getting your menses earlier, much earlier, like at 8 years of age. Or you might end up having your menstrual cycles and then becoming irregular, or you may not even end up getting your menstrual cycle, and then you may get it and then revert to an irregular cycle at a later age when you have gained a lot of body weight. So everything, there's a reason for it, and all of it is dependent on our female constitution, our body weight, our hormones.
Okay. Yeah. So when should one be concerned about an irregular period? Because there's like reasons which aren't as serious, like PCOS or tumors, etc. So is there like a line which is definite?
Precocious puberty is one which parents, of course, will be aware, and they're alarmed and they know about it. We don't see it very commonly these days, but it happens. So that's one thing. And the other extreme is when they don't menstruate at all. These are two extreme reasons why people will be very much alert about it. You know, an early menstrual cycle alarms the parents. They bring the child immediately. Nowadays, even 9.5 years, 9.5 years has also become a normal thing, you know, to get your menstrual cycle that early. But still, it is so alarming for the parents and the child. You see, just when she's getting to know that there's something called a period, you suddenly get it, but your friends are getting it
Yeah.
at 11 and 12. So that's one thing. And the other extreme that we see is when they don't menstruate at all. And you know, even the parents tend to wait till the time that they menstruated. Those days they used to menstruate even at 14 or 15, their first period, right? They had a later menarche earlier then because their lifestyle was different and genetic constitutions were different. So they tend to wait and then bring the daughter at 15 years or 16 years when actually they would have had a genetic condition where there's even absence of uterus or a very low functioning ovaries, which has not allowed the end organ to grow and menstruate, or something wrong with the inside the central nervous system. So um, I predominantly, these extreme conditions, people are quite aware, so they just jump up and they come. Other than that, I wouldn't alarm anybody and say, okay, you know, this is the time when you have to go and all, because people are very much aware. And when they find any shift in their natural menstrual cycle and flow, they always approach. Ideally, this is, I told you again and again, I reiterated, parents, I mean, mothers and daughters have to have that bond so that she tells her quickly so that she's brought to us at an earlier thing. We don't see, if you're asking about very alarming situations like malignancies, we don't normally see. But any kind of abdominal mass or any time that the girl suddenly shows florid symptoms of excessive hair growth or anything, then she should be brought because you never know what's growing inside. And parents tend to miss belly. It could be some, a cyst, an ovarian cyst growing inside, which possibly has a tumor, which might possibly cause a hormonal imbalance and menstrual irregularities or something. And or they have endometriosis, which is very common. And so the late teens or early reproductive age group, these things, they tend to miss. So, not only girls should be aware of, what's happening with their body and their changes, but parents should, I mean, mothers especially, should also be aware of these things.
Yeah.
Yeah.
Okay. How much importance would you place on lifestyle factors in the development of menstrual disorders, or like sleep, exercise, diet?
I would place our entire life on lifestyle. There's no percentage. Everything we do today is an investment for tomorrow. So I think I've literally screamed this from the rooftops that everything is from our childhood, from when we were born to what kind of a diet our mothers have put us through, and what kind of a preteen, that is pre-adolescent, or before we got our menstrual cycles, what was the diet, what was our body weight and constitution, were we an obese child, were they overfeeding us with everything possible, were they overfeeding us junk, everything that translates into our teenage, reproductive, perimenopausal, postmenopausal, everything stems from our lifestyle and what food is on our plate. Now I'm a firm believer of that because of what I've seen. Look at the number of cancers, 1 in 4. And look at the transition of cancers from cervical to breast. We're leading in breast cancer. Earlier, we were leading in cervical cancer. So if you want me to place our any kind of emphasis on lifestyle, I would say our lifestyle is everything. Mental, physical, and what we are going to take forward or what we are going to develop, the illnesses, everything is our lifestyle. So the earlier we start, the more aware we become, the more health benefits we will reap when we reach certain age groups, where as women, because we are completely hormonal dependent and we are completely swayed and controlled by our ovaries, whatever we face in later half of our life, our credibility will go to how we lived our life and what was our lifestyle. Yeah. So fitness, healthy diet is something that is golden rule.
Okay, so I have a question. So if somebody exercises, has a healthy diet, and like, is it still possible for them to develop?
Yes.
Like, so there is like, is it
Developer?
possible for them to develop a menstrual disorder? Like, even if they do everything that they could,
Possibility is there,
right?
because see, possibility is there, and I'll tell you why. So a teetotaler can develop cancer, right? And you say, oh, he or she lived such a healthy lifestyle and still they get it. Unknown to us, we are exposed to toxins, right? We can only control what goes into our body and what kind of a lifestyle we choose. But perhaps somewhere there could be a lapse, perhaps somewhere we are exposed to it by virtue of our profession or whatever it is. And there is a genetic component. Earlier, we used to think genes are everything, but now lifestyle is 70% and genetic contribution is 30%. Anytime during our life, even if we are seemingly fit in the eyes of others or in the eyes of ourselves, no person is spared of lapses in the form of stress, acute stressful situations, acute situations where you were otherwise healthy, but you were moving to a hostel or you're moving to a new environment and you have to get used to it, or you're deprived of certain elements that you were used to. You could have, based on your genetic susceptibility to tumors, you could have, you've had trouble adapting to certain situations, that the stress itself, the increased fight or flight in your body, the cortisol and everything, can cause temporary disturbances. If you're an athlete, extreme physical, endurability and things, or what you consume during the training, so many things will contribute to this. So we say we can only do at least save ourselves 70%. The remaining 30% could be out of our control because of other issues that we are exposed to inadvertently. And you have a genetic factor as well. So extremes of dieting, extremes of doing anything could also affect your metabolic hormones, and which means you will end up with some kind of a thyroid or some kind of, these things are possible. So I'm not saying it's impossible, but at least you will try to prevent these as much as possible by living a healthy lifestyle. That's all we can do.
Yeah, fair enough. So the next question is, what are the benefits you've experienced from doing yoga?
Okay. I think, everyone knows this. Yoga is a lifestyle. It's not a fad. It's not some fashion statement you do. Oh, I'm also doing yoga. It takes, one thing what it has taught me is discipline. And yoga takes care of your mind. So when yoga takes care of your mind, I always say a healthy mind, healthy body. It can also be healthy body, healthy mind. So our mind controls everything in us, everything. And yoga can discipline that mind. And what you see, if you're seeing me on Instagram or whatever it is, it takes a long while to be wherever we are. There is no age limit, or age is not a barrier. You can start at any time. And yoga is known, is a lifestyle for thousands of years, and is known to relieve, like today's topic is full of menstrual health and menstrual hygiene, and it deals with dysmenorrhea and cramps and PMS and dysphoric symptoms and everything. So when you incorporate any kind of activity which creates discipline on your mind, I think it should be a very good additive to your controlling any of your menstrual symptoms, and also for general fitness. Now, yoga will give you endurability, flexibility. It keeps you calm. It keeps you well balanced in situations. It keeps you grounded. It gives you humility. It gives you all kinds of other personality things that you need. But if you are a person who has health issues, who is obese, and who's looking to actually control, so there's something which I have to talk medically versus a very spiritual and a very all-encompassing healing thing like yoga. I'll give it 100 marks. But if you're looking to treating specific issues with obesity and morbidity related to obesity, and you have hypercholesterolemia or any kind of medical disorders, that requires a different discipline. You try your weight loss techniques by whatever is recommended, as well as you can incorporate yoga into that. Like, you can't equate one with the other. You see, eventually this is going to be your lifetime investment and lifetime healer. But if you have specific issues, they have to be addressed in a specific manner, and you incorporate both in your life. Because why I say this is, people say, oh, I'm doing yoga, I don't know, I'm not getting flexible, or I'm not losing weight at the rate that I want to. I said, this is, what am I trying to tell you? It's a lifestyle. Okay, this is not something where you're looking for a figure. And like one of my very beautiful yogi friends, she'll say, what is yoga body? You got a body, you do yoga, you get the yoga body. You see? So all these things that you see, so many websites that you see, so many yogis that you see, they are years and years and years of hard work and practice. Didn't come overnight, years. So I would say it becomes a part of your lifestyle, and you have to invest in it and be true to it. Be true to it. The other half will benefit with cardio activities, with physiotherapy related activities, with even obesity alleviating surgeries, which are important for some people, bariatric surgeries. So that's a different group altogether. You see? So you can't promote one against the other and say this will cure everything there. You've got to work on it simultaneously. Where a doctor or a surgeon is concerned, or where a physiotherapist is involved, or whatever it is, multiple specialties involved, you do that, and then you begin your lifestyle over here. And if you introduce children, and if you start encouraging children to start making yoga as a lifestyle from that age group, then you know you've given them a good investment to take care of themselves. It's up to them. They make use of it, they make use of it. They don't make use of it, you can't do anything about it.
Yeah. So I think there are two questions. I will answer these before going on to the myths. Okay, so the first one is, 1 second. I'm not able to get the question. Okay, yeah. Oh yeah, I think we've already answered this, but it's, are there any specific necessities or products required to maintain menstrual health?
I think we covered that.
Yeah.
Like, yeah, I've kind of spoken about it.
And someone said, hi, my question is, endometrial level varies every day.
Doesn't make sense, but
I'm not too sure. If this person could elaborate.
No. Endometrial level
varies every day.
Level. See, if they're talking about thickness, that's the level. The thickness varies every day. It's a very generalized statement pertaining to what? We don't know that. So if they're talking about thickness, how would you know that it's varying, first of all? And second is that people who do build up a lot of endometrium because of hormonal issues and things, they tend to bleed a lot during the menstrual cycles. We call it menorrhagia, more than 80 ml in technical terms, and that is related to specific conditions, especially thyroid disorders. So that's when these things happen. So anyone who has excessive menstrual bleeding or who are bleeding continuously or who don't bleed for a couple of months, like in a typical PCO, they come and then they bleed excessively because all the endometrium has built up so thick and there is unopposed estrogen action in the body, which is what makes it so thick. And then one fine day that is shed and then they start pouring like a tap. So these are the kind of
Yeah.
things that we deal with, which is when they kind of rightfully approach us and we are able to tackle it then and there. So that's fine.
Mm.
And what are the other things? Should we go to the myths? Because I think we're kind
Yeah.
of shooting our time.
Yeah. So the first myth is, will tampons break your hymen?
Will tampons?
Break your hymen.
My quick answer to that is, who cares? If you care, so it's a thin membrane, and why do you care if there's a hymen or not? Simply don't care about it. If you do, while inserting a tampon, you do break it. I mean, you do have some kind of a bleeding or anything which is outside of the menstrual thing, and you feel some anything which is icky, any kind of fleshy feel or anything, just come to the gynecologist and talk to us. That's it. So otherwise, I don't think one should be worried, because I already debunked that hymen is not a sign of any kind of virginity. You can lose your hymen to any kind of activities other than sexual intercourse. So
Yeah. The next one is, can you swim while on your period?
okay, so there are varied debates, as in, think about it. How do you feel when you want to go for a swim, especially in a private pool, or I mean, where you have known people around you, or in a public situation, or if you're on a beach. There are different situations where you tend to get wet, right? It's not just necessarily confined to a pool. So my take on that is, you can swim, but make sure they are on your light days, preferably for your own safety and health and for your own hygiene, as well as a, that you don't bleed heavily. You're not a heavy bleeder, because then you have other people to take into consideration. Yes, use a tampon, get in. Use a cup, get in. You've What happens is, you have to be very careful about your hygiene during those days when you attempt to go for swimming, probably continuously or every day or whatever it is. And you have to make sure that that you change or you wash the cup or the tampon or whatever it is. You change it, and ideally do it on the less flow days. Actually, when you get in, the uterine pressure and the water pressure, there is a difference. So usually you don't bleed into the pool. So when you're actively playing the pool and doing whatever your swim or whatever it is, it tends to hold up, and the bleeding starts when you tend to get out and go into the place where you want to wash yourself. So you may be well protected in that way, but think about it, think how comfortable you are, and then go ahead. No one's preventing you.
Okay. Next is exercising while on your period unhealthy, and can it damage the uterus?
Nope. You can exercise throughout. Where yoga is concerned, inversion poses we normally don't do during the period, and that is your, any kind of inversion poses during yoga, that is not okay. But otherwise, everyone exercises during periods. It's just a physiological phenomenon, and there's nothing to worry about it.
Okay.
If you can handle it, handle it. If the person can handle it, they can handle it. Yeah.
Can you get pregnant while on your period?
Very, very, very unlikely, because all these are considered the safe period. But in anyone who's having a short cycle, a very short cycle, you can never say, because it depends. Suppose see, a very quick thing, which is, over the counter advice, they'll say just before your menstrual period and just after might be your low fertile period, because the egg has to mature and develop, and it's usually mid-cycle the ovulation takes place. But in people where you cannot predict what their ovulation is like, or people who are very short cycles, there's a very, very, very minute chance of getting pregnant. So but by and large, the risk is very low. So it's actually probably better than taking a risk right after, because
Okay.
sperms can survive for 72 hours.
Yeah. Okay, so I'll just put another question.
Okay.
The last part is regulated with 3 months periods, correction pills.
What are you saying? Like oral contraceptive pills? Let me see that. No, there's something else here. Will AMH increase after periods are regulated?
Increase after regulated
No.
period.
Okay, so okay, so this is probably I don't know. Could be one of my patients. I don't know, but because there's a question about AMH, which is the anti-Mullerian hormone, and which is one of the prime hormones that we measure to assess a person's ability to become pregnant or their fertility status. Why we choose this hormone as of the recent years over some of the other favorite ones like follicular stimulating hormone, luteinizing hormone, and also another one where we look at the ovaries and their size and the number of follicles during the menstrual period, because during the menstrual period the ovaries are very quiet. So these are all techniques where we assess a person's fertility status. So AMH out of all of these is supposed to be a constant, which means you can measure this value at any given point in a menstrual cycle, unlike the others where we specifically have to wait during the period and measure it. Now, AMH is not something we are trying to control. AMH is something that's going to reflect about your ovarian reserve and how you will respond to any kind of fertility treatment, or whether you should go and immediately see a fertility specialist to, in case you're considering getting pregnant and you've waited too long and it's low or something and you're alarmed. The hormones that we are trying to target by giving oral contraceptive pills, in case if you're thinking what I'm thinking, that you're probably taking fertility treatment, is the FSH values, which could be over 10 or 12. And then we possibly would have given this to try to regulate it and bring it down. Chances are it may or may not amend to treatment, because everything is interrelated to your basic genetic pool of eggs.
Okay, I think the other questions aren't relevant for this life. Yeah.
Okay.
So the last and final thing is, could you give us a few tips to make our periods more pain-free or manageable? If anything.
I would. So what has helped and what I've seen is incorporating a nice, healthy diet. I'm a vegan, so I would push that. But if not, try to be vegetarian close to those days. Get your dairy products and meat-related products a little bit, less, or preferably not. Incorporate fitness routine into your lifestyle. And in case you do all of this and you still suffer and you need a checkup, you know where to go. But there are many things that you can do to alleviate your cramps. And I would say that one of them is, don't shy away from taking an antispasmodic or a pill, in case people are frightening and saying, don't swallow this or don't take this or anything. No, you can take it. You want to be comfortable. I would also advise that you try to make yourself stress-free, knowing that you're anticipated. Nowadays, everyone knows about PMS. Everyone knows what's coming up. Everyone knows their mood swings. And everyone knows that once the period starts, then your moods start to become a little bit better. The first 2 days are miserable, and then your yelling, screaming stops, and you're more acceptable. Now, this is a known cycle. So why don't we help this known cycle by knowing that we know where we are going? So let us make ourselves physically fit, have a nice healthy diet, get more hours of sleep. Try not to take on stressful projects during those cycling days, if possible, if you're having that kind of a lifestyle. We also give pre-rose, evening primrose medication, along with vitamin E for certain individuals. We also make sure that they have enough folic acid and calcium supplements and things which also help them. And any kind of aromatherapy, any kind of massages on the low back, or any kind of emollients that will help you, go for it.
Okay. Yeah. Those are all the questions I have, and I don't think there are any more questions here which we can answer. There's a few on the comment section. Is it okay to take painkillers during
Yeah,
this new
I
month?
just said that. It's fine. But you
Yeah.
know what? So the another thing is you can't just overdo it. So ideally, people who are having severe cramps during periods, it's nice to come for a checkup and make sure there's nothing else happening. Maybe some subclinical infections can cause this kind of a thing, especially when they are not sexually active and they are having. It would be good to come for a checkup. And if they are sexually active, even an infection could be leading to severe period pain and cramps. So it will be ideal to have an opinion in case it's really disturbing their lifestyle. But taking an antispasmodic or an anti-inflammatory agent during that time is not banned, or it's not taboo. And only problem is overdosing. People may just be popping pills without addressing the main core issue, without getting a checkup done. So that's what I would advise against. No overdosing, no just ignoring it and brushing it if it's going to be a very regular phenomenon.
Yeah. There's another question, but it's not really related to the whole topic that we were starting the questions on. I think we have to end the live stream. Like
I think
it's,
we should. Yeah.
yeah, it's becoming really long to
Okay,
okay.
fine. Yeah, because it's
Yeah,
6:30 and I really
yeah,
have to get going. Is
yeah,
that okay?
exactly.
Was that
Yeah.
okay for you? Do you have
Yeah,
any other
this
pending
is,
questions from your
no,
side? Okay.
I don't have any more questions. I
Okay.
think you answered everything very well. So thank you so much for
Thank
that.
you so much for having me, really. And I hope it was beneficial to all. So,
I'm sure it was.
I, thank you. So,
Yeah.
shall we call it a
Yeah,
day
I'll
then?
end the live stream
Okay.
now. Yeah,
Thank you.
thank you so
Bye.
much.
Bye.
Bye.